Simon Thomas is a 45-year-old and lives with his wife, 3 young children and their dog. He has been living with motor neuron disease for 3 years and is supported by a nurse specialist in the community. He has progressively lost his speech and ability to swallow. He now uses a computer to aid communication. He currently doesn't require intervention for his respiratory function. Simon is fully aware of the uncertainty due to his disease, but has a very positive outlook and wants to do as much as possible with his limitations. He has recently completed an advanced decision to refuse treatment, or ADRT, refusing non-invasive ventilation, insertion of a PEG feeding tube, and cardiopulmonary resuscitation. He is visited by his nurse specialist, and in conversation he referenced his ADRT. The nurse suggested it would be helpful to summarise his wishes relating to a potential future emergency on a ReSPECT form. He clearly expressed that he would not want his life to be prolonged in a poor state. They also discussed what's important to him: his family, his dog, being able to communicate, and being in a calm environment where those caring for him know how he communicates. He confirmed he would want oral or IV antibiotics in the event that treating an infection would lead to ongoing quality of life. Hospital admission for IV antibiotics would be acceptable if this wasn't available in the community, but his preference, if possible, would be for hospice admission if the problem could be treated in this environment. Simon expressed that he wouldn't want to die at home, as him and his wife felt it would be too distressing for their children. He expressed his preference to spend his final days in a hospice or a community hospital if possible.
ReSPECT documents are not legally binding. ReSPECT recommendations should be used to guide immediate decision making by health and care professionals responding to an emergency. The responding clinician remains responsible for decision making, however, they should be prepared to clinically justify reasons for overriding the recommendations on a ReSPECT form.